Hi, everybody. I'm Liz Voiles with the Keep America Safe Coalition. Thank you so much for joining us today. So, again, if you're just joining, to get things started, we have prepared a poll for you. We want to make sure that we're supporting you and your work to preserve the CDC Injury Center as best as we possibly can in 2026. So please fill out our poll and let us know what you would like from us this year. The options on there are messaging support, help in setting up congressional meetings. We're going to talk in a few minutes about a Hill Day that the coalition is preparing in March. Um, Advocacy webinars, where you can hear from the government relations team about the latest of what's going on the Hill and with the administration. Um, Up-to-date materials for briefings, calls or emails that you may be delivering to policymakers, or if you would like to facilitate us to help facilitate discussions with Injury Center officials. If there's anything not on that list that you would like from the coalition in 2026, feel free to put it in the chat. So this coalition, mighty as it is, was formed last year in response to proposed cuts to the CDC National Injury Center for Prevention and Control. And it is organized by the Safe States Alliance. We have grown so much since this time last year when this was just a seed planted in the ground. Our mission is to educate and inform policymakers about the Injury Center's unique and critical role in preventing injury, suicide, and overdose, and all the issues that you all work on in the cities and states around the country. Today, you're going to hear from two expert speakers. You're going to hear from Sharon Gilmartin, who's Executive Director of the Safe States Alliance. She's going to provide updates on the coalition's progress in 2025 and tell you a bit about what we all accomplished together. And you're going to hear from Paul Bonta, who's Director of Government Relations at Safe States Alliance. And he's going to share updates on the latest of what's going on with Congress and what to look out for in 2026 when it comes to the Injury Center. Before we get to our speakers, I just want to cover a little bit of housekeeping. You're going to hear today from our speakers who are going to be recorded. This whole meeting is recorded, and we're going to share it with everyone who registered after the event is complete. We're going to have some time for questions. You're going to hear from our speakers first, and then you'll be able to ask questions. You should submit your questions in the Q&A box at the bottom of your screen. You should use Q&A, not the chat, to submit your questions. It's easier for us to keep track of what's been answered already if we have them in the Q&A. If you have any technical difficulties at all, you can raise your hand and someone from the tech team will reach out to you and help troubleshoot. So just use that raise hand button at the bottom of your screen. Okay, now I'm going to hand it over to Sharon Gilmartin, Executive Director of Safe States Alliance, which oversees the Keep America Safe Coalition.
All right. Thanks, Liz. Good afternoon, everyone. It's nice to see so many of you here today. Like Liz said, we're going to set the stage for the year ahead, but I first wanted to take a few minutes just to underscore all that we were able to accomplish together last year. Certainly before we dive in, I will say this as plainly as I can that 2025 was not an easy year. So many of us were operating in an uncertain funding environment. We were navigating delays and we were responding to very real threats to programs that we have invested in, programs that we know save lives. And it was really challenging to watch the infrastructure and the systems that many of us have spent decades building being threatened or dismantled pretty carelessly. But yet, despite all of that, this community here really rallied and made real meaningful progress in that chaos. So there's an infographic here on the screen. And as you look at it, I just want you to see that this isn't just a list of wins. It is really a reflection of collective action and what we can do when we channel that focus and that energy. As a group, you all spoke up over and over again at really critical moments. You spoke up when our current year funding was delayed and uncertainty was high. You spoke up when OMB was holding up the release of already approved funds. You raised concerns, you asked questions, and you applied that pressure. Ultimately, the funds were released, and that outcome didn't happen in a vacuum. It happened because you, as advocates, stayed very engaged and persistent. Um, Walker, you got excited on those slides, but yeah, we can go to the next slide now because one of the most impactful things that you all did this year was meeting directly with members of Congress. And you can see here you showed up in a big way, virtually and in person. And that made that case for continued funding for the Injury Center. And I think one of the things that I most appreciate is that you didn't speak in the abstract. You spoke from experience, from your communities, really from that work on the ground. And that matters. We'll say it again, members of Congress consistently tell us that hearing directly from constituents, especially those working every day in the field to prevent injuries and violence, is what makes their funding decisions very real and very tangible. We can go to the next slide. The other area where we saw very real momentum was media engagement. This was a year where injury and violence prevention could have very easily been overshadowed by other headlines. But because of your willingness to share experiences and data and real world impact, we were able to bring these issues to the press in a way that resonated. And you all brought those stories from state programs, from local initiatives, hospital settings, community work, research. You trusted us with those real examples of what the funding enables and what's at risk when it disappears. The coalition role and the safe states role was then to distill those stories and to translate them into compelling narratives that the reporters and the policymakers could really digest and understand quickly. So that's what we did, and we shared them with media outlets. We incorporated them into our outreach to congressional offices. And that really created those opportunities for you then to easily and concisely reinforce those messages yourselves. And ultimately, that bought us credibility with our stakeholders, real stories from real people doing real work. That's what cut through the noise, especially in challenging political environments like what we had last year. So this slide, I just said right before this call, it just blows my mind every time I see it. This is our media engagement desk last year. And I just want to be so clear that none of this happens without you. The coverage we secured, whether it was the national outlets or the regional press or even some trade publications, again, was possible because people in this network were willing to speak and be quoted and just really help illustrate why injury and violence prevention matters in their communities. And the media attention is not self-serving. It's reinforcing to our policymakers that these issues are being watched, that real people care, and that decisions around funding and policy have real consequences in their communities. So every interview, every quote, every story you shared strengthens that case for sustained investment. So before I hand things over to Paul, I just want to take a moment to acknowledge the emotional weight of this work that we all undertake and how much you've already invested in the fight. We know the work itself is not abstract. Injury and violence prevention work is hard. It involves loss and trauma and systems that don't always move as fast as we need them to. And that the advocacy in and of itself can be kind of grueling, sometimes feels a little bit of an endless path. So a very, very hearty thank you, genuinely, for sticking with this work, even when the progress does feel incremental or uncertain, because I think what you see in these slides is the proof that the collective action works even in tough years. And it's your persistence and your willingness to stay engaged that are making the difference. So thank you from the bottom of my heart. And it's really nice to look back and see what we were able to accomplish in 2025. So with that, and with that perspective, let's shift to looking ahead, buckle up for another year, and I will hand things over to Paul, who will walk us through the here and now right now. So Paul, over to you.
Thank you, Sharon. Thank you all for taking the time to join today's webinar. It's good to see you all. So let's talk about the appropriations process, where things stand today. The Labor, Health and Human Services and Education Appropriations Bill is the appropriations bill in Congress that we aim to influence because that's the appropriation measure that carries the budget for the CDC Injury Center. So we are fortunate to be in the position that we're in today with the Senate Labor, Health and Human Services and Education Appropriation Bill providing $761 million to support all current injury center funded programs, while the House bill provides a more limited funding level of $665 million for the injury center. Now, it's important to keep in mind that out of that $665 million that the House proposes to provide for the injury center, $505 million of those funds are being allocated to support the injury center's overdose prevention efforts. So as a result, that leaves precious few funds available to the injury center to support the many different programs that they have within their jurisdiction. Let's move on to the next slide. So as a result, we've called this webinar and we're urging all of you to send emails to engage with your representatives on the House side to urge that they support the funding levels that are in the Senate's version of the Labor, Health and Human Services and Education Appropriations Bill. We have heard from both Democratic and Republican staff in both chambers of Congress who have confirmed to us that these negotiations are taking place right now as we speak. So since the funding level in the Senate bill and in the House bill are different, lawmakers in both chambers have to negotiate the differences between both bills. And as I said, those negotiations are actively taking place right now. We've also heard from congressional staff who have said not only are these negotiations taking place right now, the goal is to complete these negotiations by the end of this week. The only way representatives in the House will acquiesce and support the funding levels that are in the Senate bill is if they hear from their constituents who urge that they support the full funding for the injury center, that $761 million that are in the Senate bill. We have our Advocacy Action Center that's been primed to help support you in sending emails, in placing phone calls. We have talking points and state-specific fact sheets available to you all to make this as easy as possible. If you visit our Advocacy Action Center, you'll see that we have an email template there available for you to send directly to your representative. But please feel free to modify, to edit that email and to include those injury and violence prevention programs that are most important to you. Next slide, please. So, as you all know, federal agencies are operating under a continuing resolution that expires at the end of this month. What that means is that lawmakers have to approve the various different appropriation bills that are required to fund all federal agencies between now and the end of this month. We've heard directly from lawmakers who have said that they intend to complete this work over the next few weeks because there is broad bipartisan support to avoid another government shutdown, which is why it's so critically important for everybody to engage within the next few days. Every signal we're hearing, we're receiving from lawmakers, from appropriators in Congress, is that not only are they actively negotiating the CDC title right now, but that they intend to get this bill passed in the House and the Senate by January 30th. One other point to make about the continuing resolution is that when this current continuing resolution was passed back in November, lawmakers included the language protecting federal employees from any additional RIF notifications or reductions in force measures. Unfortunately, that language expires when this current continuing resolution expires. But I just want to say that the good news is that lawmakers from both parties and lawmakers from both chambers last November agreed to include language in this continuing resolution, heading off any opportunity to have the administration issue additional RIF notifications. So what we're hearing is that lawmakers are likely to include similar language in the appropriation bills as they make their way through Congress to protect federal employees from additional RIF notifications. So just another word or another update about the RIFs and where they stand. So for many of you who are CDC Injury Center grantees, we know that at the end of last summer, many of you experienced delays in receiving your notices of award and receiving your funds from the Injury Center. And we know that many Injury Center grantees will be expecting new notices of award next month. We collectively worked together at the end of last summer to ensure that the Injury Center was able to disperse their full complement of funds to all of their grantees. And so if you experience any delays in expected NOAs next month, please reach out to us and let us know. The only way we know whether or not grantees are experiencing delays is if you reach out directly to us and let us know. So please, we encourage you to communicate that information to us directly. Next slide. So what will happen in the months ahead? Next month, it's hard to say this, but it's already, next month, we're expecting the president to submit his fiscal year 2027 budget request to Capitol Hill. Soon after that, appropriators will start drafting their respective appropriation bills from input from their from their colleagues in the House and the Senate. And we will once again work with our champions in the House and the Senate to circulate a Dear Colleague letter urging support for full funding for the Injury Center during the fiscal year 2027 appropriations process. One note to make is, yes, we're calling on all of you to engage with your representatives here over the next 1 to 2 days. But we want you to know that there will be additional work in the months ahead because this community, as Sharon noted, did a tremendous job of engaging with policymakers to protect all funding for the Injury Center. If you recall, at this point last year, after the president submitted his budget request to Congress for fiscal year 2026, I think the mood within the injury and violence prevention community was fairly somber because the president had proposed to eliminate all funding for Injury Center funded programs. But as a result of everybody's engagement, as a result of everybody's work to educate lawmakers about the important work that the CDC Injury Center does, we now find ourselves in the position we're in today, in which we have a bill that fully funds the Injury Center, another bill that provides a more limited funding level, but we are far better positioned today than obviously where we were at this time last year or where we thought we would be once we saw the president's budget request submitted last year to Capitol Hill. So I mentioned that to make 2 points. One, we're going to have to pull out that same playbook for fiscal year 2027 to push back on any effort by the president to proposed a reduced funding level for the CDC Injury Center. And my second point is that given that this is an election year, given that we will have midterm elections in November of this year, we're going to be facing a truncated legislative calendar. And what I mean by that is once lawmakers leave Capitol Hill for the August congressional recess, they are going to be fully focused on their campaigns. And so the appetite to come back after the August congressional recess and engage in any type of meaningful legislative action is going to be almost zero. So the legislative calendar, as I said, for this year is fairly truncated. And so while we will come back and call on you to engage with us, engage with policymakers once the fiscal year 2027 appropriations process kicks off, know that we have an intense period of time of engagement now, but then things will slow down. Let's move on to the next slide. So I'm pleased to announce that we have a Hill Day scheduled for March 23rd in Washington, D.C. I know that some of you on this webinar have attended previous Safe States Hill Days. We encourage all of you to consider spending the day on Capitol Hill on the 23rd of March with your colleagues, meeting with your representative, meeting with your two senators to continue to educate them about the injury and violence prevention programs that exist in your state. We have a QR code. We'll have a link in the chat that you can access to register for Hill Day. We have a poll. We'd love to know your availability to attend our Hill Day. But my last comment about Hill Day is we organize Hill Day with one goal. Well, two goals. Yes, to educate policymakers about the important work that the CDC Injury Center does, but we also organize Hill Day to make it as easy as possible for all of you to attend the day. What I mean by that is we will be providing a staff briefing to attendees virtually the week before Hill Day. We will be providing a staff training to attendees the morning of Hill Day. And we will have a number of different handouts that morning available to you that speak to a variety of different injury center funded programs for your use when you meet with members of your congressional delegation. And yes, by all means, we also encourage Hill Day attendees to bring your own materials to feature and to promote those injury and violence prevention programs that are having the greatest impact in your state and those injury and violence prevention programs that you care about most. At the end of the day, Hill Day is really all about allowing advocates to spend a day on Capitol Hill simply talking about the injury and violence prevention work that they do back home. Next slide. So just to review, please get in touch with your representatives, access our Advocacy Action Center to send an email, to make a phone call, urging that your representatives support the Senate funding level of $761 million for the CDC Injury Center. Please consider joining the Keep America Safe Coalition and Safe States Hill Day. And yes, be on the lookout for a communication in the months ahead about the need to build support for the Dear Colleague letters that will be circulating in the House and the Senate. So with that, before I turn it back over to Liz, my last four words, it's in your hands. Thank you all. You've all made a difference. It's now time to make one last push. Thank you.
Thank you, Paul. Okay, thanks so much, everyone, for how active you're being in the chat and answering all these polls. We know we're giving you a lot of homework to do today. And as usual, this group does its homework on time. So next we're going to move to the Q&A. Just a reminder that you can click the panel at the bottom of your screen, find the Q&A box, and that's how you can ask a question of Paul and or Sharon while you have them on the line. Just make sure that you add who you are and what your organization is as you ask your question. We have a couple questions that have already come in. So I am going to ask those of Paul and Sharon now, but please continue to visit the Q&A box as we go. Paul and Sharon, do you anticipate any changes to the NCIPC extramural research funding program?
Yeah, that's a great question. Any changes to funding for extramural programs at the CDC Injury Center will be fully dependent on the final funding level for the CDC Injury Center. So if we all collectively are able to are able to protect that $761 million for the CDC Injury Center, and that's what is approved in the final labor HHS appropriations bill, then I anticipate no changes. The only changes that we'll see is if that $761 million amount for the injury center drops in whatever final agreement is reached.
Okay, thank you, Paul. All right, because this is a coalition of doers, we have a few questions about what people can do, which we've listed off a few things, but if the folks on the line are coming away with kind of one big first thing they should do right after they get off this webinar, Paul and Sharon, what should it be?
I'm going to give you two things. Number one, please reach out to your representative. It really is critically important that they hear from you within the next 24 hours. And all of the information you need in order to contact your representative is on the Keep America Safe Advocacy Action Center. Number two, please feel free to copy the link to our Advocacy Action Center and share it with your colleagues, share it with your networks, share it with the coalitions that you work with, because we really want to strengthen the voice in support of the $761 million in that Senate bill as much as possible. And so the two primary ways to do that is for all of you to contact your representatives right now and to then turn and encourage those you work with to do the same.
Going to yes and to what Paul said. I think everything that he said is critically important. And certainly in the short term, those are the most essential actions. I think longer term, also think about how we can spread the word about Hill Day. I think showing up in force shows a unified display for IVP in our communities, and that's really impactful for our legislators. So think about attending, but not just you, who in your partner network would also be able to share a story and really speak in a compelling way about the work that we do.
Okay, next, right, because this is really a network of networks, right? Where if all the folks on this call then turned around and took action to get in touch with the networks they're part of, that's when we're really starting to cook with gas. All right, next question is, how are the efforts to protect the Injury Center and its programs being coordinated with efforts to maintain and rebuild other CDC programs? So how is this coalition working with partners who are concerned about the CDC writ large?
Yeah, another great question. And so I'll say, we're working with all of you, our grassroots advocates. We are working with the various different stakeholder organizations that we work with at Safe States, but we are also working in collaboration with some of the other broader coalitions, such as the CDC Coalition, the Coalition for Health Funding, that aim to push or secure support, build support for the broader CDC writ large. And so we are in contact. We do collaborate with those other larger efforts, and they are not only informed about our efforts, but actively working alongside us as well.
Yeah, that's right. We are, we benefit by having a very focused topic in our coalition, which lets us to speak really strategically, and it lets us really stay on message. And I think that's part of why we've been so effective. But no doubt, what we want to do is represent injury and violence prevention in the context of overall public health and the need to continue to invest in a sustained and coordinated way in public health. So, to Paul's point, we are very much trying to represent our issues in a way that nobody else is, but using the same messaging, the same pathways in concert with our partners.
Okay, we have another question in the Q&A box. Is the PHHS block anticipated to be funded?
It's hard to predict. All I can say is those negotiations are taking place right now. And so if you support that funding stream, I would encourage you to connect with members of your congressional delegation to let them know that that program is important to you.
Okay, we'll hang on for a minute just in case there are any other questions.
So while we hang on for a minute, I will just chime back in and reiterate the fact that this group, this community has been incredibly effective, incredibly helpful. As I said, we are so fortunate to be in this position where we have full funding for the CDC Injury Center in the Senate bill. And so for all of you who care about programs that are within the Injury Center's jurisdiction, such as the Injury Control Research Centers, funding for firearm violence prevention research, funding for ACEs, all of those programs will be funded if we're able to convince representatives in the House to acquiesce to the funding levels in the Senate bill. You all have done a tremendous amount of work over the past year to get us where we are today. We just have one final stretch here in order to get us to the finish line with an entirely protected budget for the CDC Injury Center and all of its programs.
Paul, we've got a follow-up question in the Q&A. Isn't the Preventive Health and Health Services Block Grant in statute?
It is in statute. That's true, but that doesn't necessarily translate into protected appropriations for the program, because there are committees in Congress that deal with the authorizations. There are committees in Congress that deal with the appropriation. And for members of the House and Senate Appropriations Committee, sometimes they don't really pay close attention to what has an authorization and what doesn't. They may not be paying close attention to what is written in statute and what programs aren't written in statute. And while we've, I think, heard from many lawmakers who have argued that if a program does not have an authorization, then it should not receive an appropriation, there are many appropriators who are also intent on going after programs that are written in statute. So while there are a handful of injury center programs that have that statute, what I would call protection, that doesn't necessarily translate into protected funding during the appropriations process.
And Paul, I guess as we're waiting to see if there are any last questions, I just want to point out the conversation in the chat, which is a really interesting conversation. Friend of the pod, Tom Simon, thank you, Tom, has pointed out that there are a few different lines that are currently eliminated in the House budget. And he lists off a few of them: firearm injury research, youth and community violence. Um, we have Marcy Phillips chimes in about older adult falls work is not supported in the House bill either. Can you kind of break down for those who maybe lost track of all the versions of the bill, why the House version versus the Senate version matters?
So the House version, which provides a more limited funding level of 665 million, since 505 million of those dollars go to support the center's work on overdose prevention efforts, there is very little funding to support the various different programs here noted in the chat. But the important thing to note is that the Senate bill fully funds all of those various different programs. That's why this last minute push is so important. It's important because if we can urge representatives to support that Senate funding level, then all of those programs mentioned in the chat will be funded. But the only way for lawmakers to recognize that they should support the funding levels in the Senate bill is if they hear from their constituents, which is why we organized this webinar, which is why we're making this ask of all of you today. We are almost, as I said, at the finish line, and we're in a situation where like we've got the entire budget for the CDC Injury Center dangling right in front of us. All we have to do is engage with members on the House side to implore them to support the funding levels in the Senate bill. And we stand a very good chance of seeing Congress adopt a labor HHS appropriation bill that fully funds the CDC Injury Center and all of its programs. But the reason why those programs aren't funded in the House bill is because there is such a large portion of that 665 million that's been allocated to overdose prevention.
Okay, next question. Can you speak about how you're discussing protecting the injury center, understanding that staff capacity has been lost and maybe further lost by layoffs? So we have the funding issue and then we have the staff capacity issue.
Yeah, another great question. The good news is I think there is strong recognition among lawmakers on Capitol Hill that many agencies have lost significant numbers of staff, which is why they agreed on language that was inserted in the current continuing resolution, protecting current federal employees from any additional notifications. What I'll share is that we have had discussions over the past few days with Appropriations Committee staff who have signaled that as bipartisan interest in including some similar language in the appropriation bills that are making their way through Congress right now, and that the language that is being discussed is language that would call on agencies to ensure that they have the full work force complement in place that they need in order to administer all the various different programs within their jurisdiction. So I think this is an issue that lawmakers are actively discussing and negotiating as we speak, and that there is recognition that there is some type of language needs to be included in these appropriation bills in order to protect against continued losses of federal employees.
Okay, next question. Would it be helpful to include in our communications with representatives a list of funding included in statute? The Preventive Health and Services Block Grant and Rape Prevention and Education are two that I am aware of.
Not only is it important to include the funding levels for those programs, but to include some information about the impacts that these programs are having, to include some information about why these programs need to receive continued funding. And so, yes, I think the more information that you can provide to your representative's office about the funding levels, about how this program works in your state, the greater the chances are that they will recognize the need to support these specific programs.
All right, we'll just wait a beat and see if there are any final questions.
And if there are no additional questions, please, I've said this in previous webinars, but we want to make all of this as easy as possible on all of you. So if additional questions come up, if you have any questions about what to say when you reach out, please feel free to reach out to me directly. I'll put my email in the chat. There it is. Of course, Brass Ring is one step ahead of me. So please do not hesitate to reach out with any questions, with any concerns, with any issues that you have.
Wonderful. Thank you, Paul. All right. Thank you, everyone, so much for joining us today. We know it's a super busy Tuesday, and you all have a lot on your plate. Your advocacy is really making a difference. There's just no other way to put it. And we are here to serve you on this coalition and advance your efforts to protect the Injury Center. So we just want to highlight the action items that we laid out today one last time, what your main takeaways should be from this webinar. So get in touch with your members of Congress this week, please, and urge them to support the Senate funding level of $761 million for the Injury Center. Sign up for the Keep America Safe Coalition Hill Day, which is coming up in March. Let us know that you're coming. And then be lookout for communication about Dear Colleague letters that are coming soon to your inbox. We're going to share this recording with you today, along with links and resources from this meeting right into your inbox, so that you can take action today. If you have any questions after we hang up that occur to you, please reach out to us. And Paul or Sharon will be able to answer. We know that all of you are leaders in your own right of your own organizations and coalitions. So we ask you to please use your power from where you sit in order to protect the Injury Center. Thank you again so much for your time, your energy, your effort, and your heart. And we will talk to you all soon.